But Woods, you'll say, you got to listen to the science. Listen to the science has become the rallying cry of the most irrational, anecdote-driven, fact-free believers in voodoo I have encountered in my lifetime. I had Martin Kulldorff on my podcast, The Tom Woods Show. I actually bought the domain tomspodcast.com. You can get there very easily. He is an infectious disease epidemiologist at Harvard Medical School. And he told me that it may be that a lot of scientists think lockdowns are the way to go. He said, but I basically talk to infectious disease epidemiologists. And among that group, from what I can see, a majority of us are against the lockdowns, have been from the beginning. And we favor a totally different strategy of what we call focused protection of vulnerable groups. But yeah, the infectious disease epidemiologists, he said, we're not calling for lockdowns. Huh, but isn't that funny? We don't really hear from these people very much, do we? By some odd coincidence, we don't hear from them. Can you believe that people who shout at you for jogging without a mask, or who hurriedly cross the street when they see you so that they can maintain social distance, you don't get COVID by a chance passing on the street. Those people don't get to lecture you about science, okay? If they themselves were less ignorant of the science, they'd be embarrassed by their irrational behavior. The listen to the science people warned us about opening schools. The results have been fine. Even The Atlantic just ran an article like within the past 24 hours saying, the crazy warnings over the summer seem to have been overblown. Well, there's an understatement. At the universities, we've had so far 70,000 so-called cases, 3 hospitalizations, and 0 deaths. Then there's the general craziness. In the county where the city of Gainesville, Florida is, they established a 1 person per 1,000 square feet rule for private businesses. And at a meeting, the county commission chair was asked to justify this. Now, did he justify this on the basis of, well, science tells us that I mean, you already know the answer, right? None of this is all voodoo. None of it has to do with science. His answer was, well, we put that in there, quote, because it's easy math for everybody to do. I mean, if I were one of these quote-unquote listen to the science people, I would be mortified right now. I mean, I feel like I am listening to the actual science, not the voodoo practitioners, but the actual science. Lockdowns aren't science, by the way. There's no book that they're following that tells them lockdowns are the way to go. So when we get told, well, the reason that lockdown didn't work is that you didn't do it right, this is based on literally nothing. And I asked again Professor Kulldorff about this. He said there's essentially no chance of eradicating a virus in this way. What you can do is cause a huge number of ancillary problems that will be worse, but you won't eradicate it. Now, they can get away with that because we just don't mention those ancillary problems. We shouldn't even call them ancillary. If I show you charts of different American states or different countries, and we look at cases or deaths or whatever, you will not be able to tell me which one of these places, which ones locked down, when they locked down, how hard they locked down, when they lifted the lockdown, whether they had a mask mandate, when they imposed the mask mandate, and when and if they lifted the mask mandate. You have absolutely no way of knowing that. Now, if these things were as powerful as we're told, there darn well better be some clear and obvious way of distinguishing one jurisdiction from another, and there is not. Therefore, it is voodoo. And I think the more we use the word voodoo, the better. I have an article linked on a special page I put together that goes through and justifies this and looks and says, look, obviously the lockdowns did not solve the problem. So you can find that on my website, tomwoods.com/COVID. And you'll find some other very interesting things there as well. But in the interest of time, I'll refer you to that there. Same with mask mandates. Now, is it possible that certain types of masks in certain types of situations, when worn correctly, could have some minor effect? Sure it is. But the religious fervor behind masks, which it clearly cannot be justified, because we're being told if we had worn masks sooner, or if we just wear masks for 6 weeks, this will all stop or whatever. Again, go to tomwoods.com/COVID. I've got the charts up there for place after place after place after place. And on each chart, it's indicated exactly when the mask mandate went into effect. And you ask yourself, if I hadn't told you where on that chart the mask mandate had gone into effect, would you have been able to tell? Would you have had any idea? So if they're that effective, if they're so effective that the director of the CDC says they're better than a vaccine, you would think we'd be able to see it on the charts. Can't see it at all. Nothing. Oh, it would be worse if we did. Come on. We should see something. Nothing. There's a guy on Twitter, Eric Topol, T-O-P-O-L, who is one of the big, the world is ending apocalyptic people on the virus. And he told us the reason Japan did well is their government shipped masks to the people. Okay, if you needed any more evidence, this guy is a total BS artist, there you go. Because number one, yeah, they sent enough masks to last people one day. Secondly, the masks were all the wrong size. This is a government after all. They're all child size. Nobody could fit them. So everybody in Japan laughed and joked about these masks, and nobody wore them. But this know-nothing idiot is on Twitter lecturing us about this. He doesn't know a thing. Again, look at the charts for the Philippines, the most mask-compliant country in the world. Hawaii doesn't have a neighbor for 2,000 miles. And they wore masks religiously. It didn't do a thing in terms of cases. What exactly would the graphs have to look like in order for the lockdowners to say, maybe none of this does any good? What would they have to look like? I think they'd have to look exactly the way they look now. Meanwhile, in the Sun Belt, I live in Florida, the spike there fizzled out on its own everywhere, despite different policies. We were told, oh, they're going to be, I saw on Twitter, we're going to have 500,000 deaths, we're going to have dozens of New Yorks if they don't lock down. We didn't lock down. We didn't come anywhere near that. In Florida, the only thing that happened in some places was that some bars closed, but what really happened was the bars pretended to be restaurants and they kept going. And that was it. And I guess when the virus was tricked by the bars pretending to be restaurants. I mean, what kind of BS is this? California, where they have this massive lockdown, their curve looks exactly like Florida's. And a friend told me at his work, they're scared of an applicant from Florida. And they said, we got to be careful. They do things differently there. Their curves are the same. Paul Krugman, when Governor DeSantis said he was opening up Florida, Paul Krugman said, oh, that's very unwise. They're still having over 100 deaths per day in Florida. No, they're not, you ignorant moron. We're not having 100 deaths per day. They're reporting 100 deaths per day. Now, reporting date is very different from actual date of death. So, for example, I just looked at October 1st. October 1st, there were, let's see, I guess 130 deaths reported. 65 of them were in September, 54 were in August, another 11 were in July. There are no 100 deaths occurring per day. And with hospitalizations plunging, it's not like 3 months from now when we recount today, it will turn out to be 100. No. So he doesn't even know that, or maybe he does and he's just being an idiot. I don't know. And now we've learned from the New York Times, as I mentioned before, that up to 90% of these tests that are coming back positive could be of people who are not contagious and therefore are being ordered to isolate for no reason. Because the PCR tests that they're using are being calibrated in a way that they're super sensitive in the United States. So in Europe, they're using about, let's say, 30 cycles. In the US, it's 37 to 40. In Arizona, it's 40. At 40, they're detecting nothing. That is completely pointless. And most of what's going on in Arizona is at 40. So in Washington, D.C., a fellow named Phil Kerpen from American Commitment asked them, what's the cycle threshold that you're using for these tests? And D.C. Health got back to him. D.C. Health, quote, does not have information about cycle thresholds. What kind of a joke is that? So the tests could be completely meaningless, and they're not even going to, we haven't even looked into it. Now, finally, an immunologist, like somebody who is an expert on immunology, like Dr. Fauci, is not taught how to balance public health concerns. People say, oh, just listen to the experts and you won't listen to the experts. Well, I feel like I am listening to the experts, but there are some questions that no expert can answer, or that some experts aren't trained to answer. There's no class that an immunologist takes that teaches, well, if you lock everybody in their houses, there could be other effects of this. That he doesn't learn anything like that. And here's how you balance it. Well, if you do this, there'll be this many of that. He doesn't learn anything like that. So it's just, again, it's rank superstition, like this is some kind of priesthood. It's rank superstition to think that Dr. Fauci could view this so holistically as to have the overall answer. We have to answer what is worth doing and what isn't. We could all drive our cars at 5 miles an hour and save a lot of lives. We don't think that's worth doing. We don't wait for Dr. Fauci to tell us what the speed limit should be. Okay, we understand the absurdity of that. And here's what Dr. Bhattacharya said. I love this guy. He's from Stanford. He is the consummate professional. He's not like me, gets really worked up, and that makes him all the more effective because he's slicing and dicing with his calmly delivered sentences. So here's what he said about Dr. Fauci, and it's about time this crazy priesthood was taken down a peg. Dr. Fauci's been involved in infectious disease control for a very long time. He's a preeminent scientist for a good reason. He's an expert. But in early February, March, we sort of put him on a pedestal to essentially give his knowledge about a whole range of things, some of which were in his control and knowledge set, and some of which were not. And I saw him a few months ago where he very humbly said, look, I'm giving you my expertise as an infectious disease expert on how to manage this disease. I'm not looking at the broader policy context. Exactly my point. Dr. Bhattacharya again. We think about science as giving us all the answers, but that's a mistake. What science does is tell us if we do A, we might get B. It's up to non-scientists to make a decision. Do we want to get B if we know the costs of getting B are C, D, and E? Do we really want zero COVID? Well, again, only a blockhead would think that's a scientific question. That's a philosophical question. And again, this is where he says, if you get zero COVID, we know that we're going to have to destroy our society in order to get it. We'll have to get rid of all our freedoms. We'll have to make sure that very few people interact with each other. Essentially, it's so high a cost that it's not worth it. Science can tell us, here's how you can minimize the probability of getting zero COVID. But it's up to non-scientists to decide whether it's worth it. You can't put one person on a pedestal and ask him to make that decision for society. I love that I live in a democratic society where those kinds of decisions aren't up to experts. It's up to people deciding together through electoral processes what we value.